Okay. Well, it's been kind of interesting. What's been going on lately? Um, well, before, like, how my body has just recently been going through some stuff. I can see here. Well, I don't know how to really talk about everything, but here we go. What's been going on lately? Had the court date. Yeah. Had that last month. Since then, what's happened since then? I'm just having to wait from the court date 30 days, no, 60 days from then for him to make a decision, which is kind of irritating, waiting for that. Send the letter, and yeah. And I still haven't heard back from the urologist. If they've heard back from the insurance or not. I'm still waiting to hear back from them so I can get this procedure done that needs to be done badly. Because I'm still having some of the same issues that I need the procedure for, the bilateral orchiectomy. So that kind of is irritating, but just have to wait for things to happen when they happen, when it's supposed to happen. Yeah. Let's see here. I've been hanging out with the roommate, the person that moved in. I've been hanging out with him more. And some things I've started noticing about myself. It's something I'm struggling with right now. I've been having bisexual feelings. I still like girls 100%. Don't get me wrong in that area. I know that 100% I like girls. But sexually, like, I don't like males, like guys, don't like guys sexually. But I just, in general, I've been having bisexual, like, feelings. Or kind of like tendencies, I can say, where sometimes I get thoughts that I probably don't want. Sometimes they can be a little towards sexual, but not fully. And it's kind of confusing trying to figure out why. The therapist thinks it's because I haven't been in a relationship since 2006. Yeah, it was January 2006. Like 12 years. And as a people, like, our interests and things like stay the same, but as people, when we get older, we change a little bit. So it's probably, she's thinking it's probably my body, like my mind craving it, like that intimacy, because I was feeling like it's more towards that intimacy is how I was feeling. So she's thinking it's probably because my body's craving it. My mind and my body's craving because I haven't had that in such a long time, and she wants me to experiment. Like she mentioned, I do want to start dating again, but I'm still having some issues there. And she was mentioning you need to do that and experiment. And I was like, yeah, experimenting. Okay. So, and also last month, it was so weird. I had 6 6 spontaneous orgasms. Yep. And the doctor, she was saying, she's had other patients, just one other patient that's had spontaneous orgasms. They don't know what's causing it. They said, we don't know what's causing it. Just had another patient that's had spontaneous orgasm. All I can say is enjoy them. So that's the only answer I've gotten, to just enjoy them. So I just been dealing with that when it happens. And luckily, it hasn't happened in public. So that's good. Let's see here. I've been learning tarot. I can say that is what's since January. I'm not going to go into details on that, but this is the deck I got, if you can see that. Yeah. But, yeah. And that's been actually helping me with who I am as a person and discovering myself further. So, yeah. What else can I think of? That's the actual physical changes. I've noticed my legs, the leg hair. It seems like the hair is spread out more. Like the hair is like spread out more. There's more spaces where there's no hair. The hair down there, the pubic area, it's a sensitive topic to talk about, and I've mentioned it a few times in the past videos, that actually has changed a little bit. I notice the hormones are changing that, like towards the triangular shape on top, towards the points on the top, like the points where it's like right here, like the point where it connects this before it goes down like that. On both sides, it's becoming more towards that. It's not 100% that way, but it's more towards that than what it was in the past. And so, and the rest of my body hair is kind of more in the normal female range. Except some places around, I noticed there's the normal, like really fine hair. That's the normal range for females. And my facial hair, what's left, is just right through here. The parts right here are gone. There's one hair here. This part right here is gone. There's some right here and here. It's all that's left, and there's less. I've just been waiting for the pigment to come in. So, and some pigment has come in. I'm just waiting for it to fully come in on everywhere as much as it's going to, because then that will help with the results. So, and also I've been more in tune with my voice. It's more staying in the female range a lot more lately. Since hanging with the roommate more, I've noticed my voice is more staying in the female range. I think it's partly because I'm a trans woman and I don't want my voice to be male around him, or fall down into that deeper range. So it's more in the female range, and it's been staying that way a lot more lately, and I'm comfortable with that. Right now, it's the time of the month where I'm on the progesterone, and the hormone fluctuations. So my tummy, I have more fat right now in my tummy. It's like, doesn't seem like the fat last month has gone away. And I still have more fat here. My breasts here have grown a little bit. 2/8 of an inch. It's not that much, but for me, that's actually significant. And I feel so much better. I'm so much happier that they're just even 2/8 of an inch is something I feel good about. It makes me feel better about myself. Because now my breasts measure 37.5 inches roughly. Yeah, they don't look that big or that like huge or anything. They're not a double D, which that's what I want. I just have the feeling that a double D would be perfect. But if I can't get to a double D right under that, where I can still wear a D cup, would be fine. But it's going towards that direction, and yeah, and right now, because the hormone fluctuation, I have more fat in them right now. So that's actually comfortable for me. And it's during this time of the month when I have more fat in them, they feel better. They feel like myself. I feel more myself. But when the fat's down from not being, from hormone fluctuation and not having as high progesterone in the system, it feels off. I just have that, it just feels off. But when the progesterone is higher and that fat's there, it doesn't feel off. It feels perfect. Fat to tissue ratio. So that's how I feel about it. So let's see here. Other physical changes. Not really. Just been more in tune with my body. Not just physically, but because of learning and more discovering of who I am and learning tarot, I can say I've been more in tune with my body. Not just physically, but spiritually. That doesn't mean religion, but the actual spirit, that who you are on the inside, that person. And I'm more in tune with that, and it's a struggle right now trying to, because I haven't been in tune with that I just really haven't been in tune with that for a long, long time. It's like, it doesn't seem like I really have been. I'm becoming more in tune with that. It's a struggle, but I feel a whole lot better with my body and myself, of who I am as a person as a whole. And that self-discovery is just limitless discovery of who I am, and it's been a struggle, but so worth it, because I'm a lot more happier, and it's helping not just like physically, but more mentally, because of my Asperger's disorder and the social anxiety. It's helping with that a little bit as well. But I still have it. It's not going away. It's never going to go away. I'll still have that forever. So it's just been helping with everything. But not to the point where it cures everything, no. But being more in tune with everything. Let's see here. Besides my ears being swollen, the earlobes, the left side's worse than the right side. It's kind of irritating. It's happened a few times before, but it's irritating. It just is what it is. And one of the other issues I'm still having is down there. The pain that I've mentioned, it keeps coming back and going away. Yeah, like my last video I was saying, female function over male structure. Yeah, that's still an issue. Because it wants to act and react as female genitalia. But it's male structure, so the thing is, it makes the skin really thin. And just your everyday life, standing, sitting, walking, whatever you're doing, it can be uncomfortable because under the surface of the skin, it can, like, yeah, the blood vessels can kind of break open, or can get bruising. And right where the foreskin meets the head, that spot right there is where it's I can't speak from others' experience, but for me, that's the most painful spot when this happens. And having, even though I don't like it, having regular, like, erections, I can say, in the male sense. And because I don't have a partner or anyone to, like, sexually do with, but by myself doing it, it helps with that issue so it doesn't get really bad. But I still struggle with that because I don't like my genitalia, and the whole other issue with having those bisexual feelings, it's hard for me in the sexual sense, in relationships and stuff. I don't know how to go about that the way I am now. And having these things happen, and not have been in a relationship for such a long time. Yes, for such a long time. I just don't know how to go about this, or where to meet someone, or how to really find someone to go on a date with. So, and I do want to try going on a date, but I'm having struggles to get myself to do so. I'm just having some struggles to let myself do so and be able to and find someone to. So, and the whole intimacy with it all. Yeah. And knowing that I am a lesbian by having those feelings, the bisexual feelings, it's hard. So that's what I'm struggling with, what I'm going through right now. So, and no really other physical changes that I haven't mentioned in the past. Because everything else I mentioned that I didn't mention in this video is probably still the same. The things that haven't changed that I mentioned. So that's what I'm going through. It's just kind of struggling a little bit with all this, the sexuality and everything. And yeah, it's a struggle. I'm getting through it, trying to figure it out. So other than that, until my next video, please comment, rate by giving a thumbs up, and subscribe. And check out my blog, because I did 2 new blog posts the other day. So it'll be in the description below. So it's about my jewelry box and my tarot journal I made. So if you want to check those out, it'll be on my blog, so description's down there, the link. So yeah, so that's pretty much everything I can think of that needs to be talked about in this video. So please, until next time, comment, rate, and subscribe and thumbs up the video, please. and comment more. I really would like everyone to just give more comments. That's what I've been wanting more, so I can like spark up a conversation with all of you who watch my videos. So yeah,